in my PPE. Okay.
We'll start with the typical start.
Yeah.
Your name.
So I'm Mike Klecheski, and I'm the team leader of the Provincial Reconstruction team here in Diwaniya.
And we'll start with the hospital first.
Okay.
First of all, what's your hometown?
My hometown is New York City.
Or,
We're proud of it.
now the medical center. Do you know the name of the medical center?
It's the Al Jamhuri Medical Center clinic, is the way we call it. Primary Health Care Clinic.
You don't know how to spell that, right?
I can give you that, but I think it's Al, A-L, and I believe the next word is J-M-O-U-R-Y. I'll confirm that later, but I'm pretty sure that's right.
When did that project start? When did construction start?
Good question, and I should have probably checked with, I'll get you, we have a
Little fact sheet.
little fact, I believe we do, yeah, I'll get you that, yeah. It's easier to do it that way. I don't want to lead you astray. So,
Just the fact that that they opened up a new clinic in the area, how do you think that'll impact the area?
from everything I heard yesterday at the opening, and from everything I know, it's a big contribution. That's an area that apparently didn't have a strong health clinic, and obviously health is of prime importance. And it struck me, at least, that it was quite well staffed. So I think the impact will be very positive. Certainly, all the indications from what I heard yesterday were very positive. They were encouraged. It's got a big workload, I must say. I was a little surprised, in fact, that it's as big a workload as it already has. It's already, we cut the ribbon yesterday, but it's been up and running for at least a little bit of time. And there are a large number of patients, so daily. So it's going to be a busy place. It already is a busy place, which demonstrates high demand. But that's good. That's exactly what we want. So.
And just in a general sense, can you tell us a little bit about the facilities and what it offers?
Sure. It's a primary health care clinic, so obviously it would provide emergency care to the very most limited extent. But it would do that. But as a clinic, it would provide, it provides a whole range of services. It has X-ray, it has all sorts of services for children. They were kids waiting to be inoculated, not quite knowing what to expect yesterday, but there's inoculation. And I was told that they have enough medicine to address that need. They have an eye doctor, or at least a service for that. So it's really going to cover a wide range of services. I think really all that a community needs in the short term. Obviously, it's not a hospital. We understand that, but for the community, it's a very big contribution.
And I know it's a recurring question, but personally, how does it impact you? It's the fact that you're contributing to the health.
This was funded with U.S. government funds. It's very, very encouraging to me to see that we're doing that kind of good work that truly affects the lives of individuals. I have to say that on my way there, I was really quite impressed at the progress in other areas. The roads are being built. They were painting the sides of roads as we were driving along. So the country is definitely on a positive trend line here, but it's very important that we contribute things like that. And I guess the word inspiring is the word I would use. So I'm very, very happy to be a part of that. It makes me feel very, very encouraged.
Was it just the funds that the U.S. contributed, or was it the Corps of Engineers helped?
Good question.
Also?
Right. No, it's very true. In many, many ways, this kind of project does more than just provide funding. The Army Corps of Engineers is really committed, from everything I know about them, and I know quite a lot about them now, to working with Iraqi engineers. So not only are you getting a good product, well overseen by the Army Corps, but you're training a whole group of very talented Iraqi engineers to further develop their skills, and that's a very, very encouraging thing. And obviously, working with the local authorities, which we were doing the whole time, and very closely working with them, is very important too, because I think it allows us to share our strengths, that is to say things like planning, which is very important to the Iraqis. And at the same time, I think we learned a good deal from them as well. So I think it was very positive from both directions. But I think the personal contact was important, the professional development was really important. Certain lessons learned, I think, are valuable. And planning, obviously, the importance of planning was one of them. Many reasons why this is a very positive experience.
Obviously, this is a very valuable clinic to have, and it's a very important step that helps build up the community. What would you say this was? Obviously, it was a much needed thing in Diwaniya.
Right.
How do you think it would have been affected if it wasn't built, or if it didn't happen?
Well, you know, the country, I think, is moving, as I say, in a positive direction. So you know, over time, we're hoping very much that the needs of the community are met. The Iraqi government is working on that, obviously, very hard. But obviously, we filled a big gap, and if we can fill a gap that would otherwise last longer, particularly in an area like healthcare, it's of tremendous importance. I mean, just talking to some of the doctors there about problems such as cholera, which has been a recurring problem in this area, in this region. You know, again, it's not something a clinic can avoid, but it's certainly something that they can help address. And education, that's another important area here, because you know, there's a lot of posters up there, and the doctors and other clinic workers there appeared to be very committed to spreading the word about the importance of certain medical techniques and the importance of good sanitary conditions. So again, that's another area that's important. So I think we contributed a great deal. Eventually, of course, all needs we hope will be met. All needs are never met anywhere, but as many needs as possible will be met. But I think we responded very much to something that was very seriously needed in an important neighborhood of Diwaniya.
And there's still, you guys can have other projects in the works.
That's right, yeah. I can give you a list, but the Army Corps is still working on quite a few projects out there. It's the same principle, which is to say working with Iraqi contractors, working with Iraqi engineers, and building, you know, what appear to be very high quality structures to respond to all sorts of needs for essential services and the like. So they are working on them and looking at other possibilities, further possibilities.
And just to clarify, the workers that worked on it as well, they were Iraqi workers?
Yes, absolutely. It's important, it's good you asked that, because the Iraqis have asked us that question, whether, you know, are we the ones doing all the work? Absolutely not. I mean, the Army Corps oversees this to some extent, and, you know, it might be worth you talking to the Army Corps folks as well. You know, they oversee the work, but as I say, it's not just a partnership with the engineers. Obviously, the work itself is done by Iraqi employees, workers, construction workers, and planners and the like. So it's definitely a joint effort.
So not only are we providing for help, we're also stimulating the economy?
Sure, no, absolutely. And it's not just short-term stimulation, because you know, developing people's skills is obviously, particularly in a field like engineering, that'll pay dividends for many years to come. So it's a big deal.